My name is Kate Biles, and I'm a doctor of physical therapy at the Christine Hayes Physical Therapy and Integrated Healing Center. I am the team leader of our pelvic rehabilitation program, and I would like to take a couple of minutes to talk to you about the importance of a healthy pelvic floor. A lot of people have no idea how their pelvic floor functions or how important it is to their health, but millions of Americans have problems with their pelvic floor, and we are happy to say that at our clinic here in Paoli, we can help you with these. The pelvic floor is an important muscle group that sits at the bottom of your pelvis, and you sit on these muscles if you're riding a bike, and there's three important functions. They hold the weight of the pelvic organs. They open and close so that you can empty your bladder and empty your bowel, and they also contract and relax so that you can have sexual function and sexual pleasure. Millions of Americans have problems in this area, and oftentimes your doctor may not be exactly sure that it's related to your pelvic floor. Even some of your physical therapists may not understand that your problems are really related to your pelvic floor. And there are two main groups of patients that we see, generally speaking. And men and women can fall into either category. We see a lot of patients who have weakness in their pelvic floor. So weakness in your pelvic floor can lead to problems to do with incontinence of the bowel or the bladder, or decreased libido, decreased sexual pleasure. And weakness in your pelvic floor can be addressed very easily with a very specific pelvic floor therapy program. Now, some people say, oh, I just leak a little when I laugh, or I just leak a little when I sneeze, or I just leak a little bit when I'm about to sit on the potty. So there's two different kinds of incontinence, stress incontinence or urge incontinence. It doesn't matter. Leaking is never normal. Whether you've just had a baby, whether you're 75 years old, leakage from your bladder is not normal, and it is not something that you have to live with. So weakness is one big problem. The other group of patients have too much tension in their pelvic floor and spasm in their pelvic floor. So that can be causing more pain issues than leakage issues. And again, you don't have to live with pain in this area. People have pain in their pelvic floor from scar tissue, maybe after you've had a baby, or from so much bike riding, or from men who've had prostatitis or prostate surgery, women who've had a hysterectomy or any gynecologic surgery. So all of these problems can create weakness issues or tension issues in your pelvic floor. But these muscles just need to be in balance. They need to be strong and coordinated. These muscles are often causing problems that look like low back pain or hip pain. So if you have any problems related to your pelvic floor, you or someone you love, then it would really serve you to see a pelvic floor specialist, get a good evaluation, and get your pelvic floor healthy. So you can get stronger, you can learn how to relax your pelvic floor, and the quality of your life can change dramatically. So if you have more questions, give us a call, come in for a consultation. We can give you an examination and tell you specifically if we think that we can help you with your problems. So thanks for listening, and please give us a call if you need us.